I'm wearing a black dress. I'm wearing a colorful beaded necklace, and I'm wearing eyeglasses. My name is Chipo Chimhundu. I'm here on behalf of the Clinton Health Access Initiative, also known as CHAI. And I'm here to share with you our regional perspective on access to assistive technologies in Africa. I have a few slides that I will share with you, and if it's possible to pull them up, I would appreciate your assistance. So as CHAI, our mission is to save lives and to improve health outcomes. We're working in 35 low and middle income countries, and 26 of those countries are right here on this continent, which is the majority. We were initially founded about 22 years ago with an initial focus on HIV and AIDS. But our focus and programs have since expanded to more than 20 programs, now including assistive technologies access. We have structured more than 140 global deals that have enabled access to life-saving products. And these negotiated deals have been up to about 90% reduction in pricing for life-saving commodities. More than 125 countries are accessing global deals that CHAI has negotiated. We are looking to do the same in assistive technologies access. What has motivated us to join the assistive technologies space is a problem which we all know and acknowledge in this room. The problem that millions of people in Africa are failing to access life-saving commodities in assistive technologies. The two main problems, which we all know, are that we have lots of small-scale implementation, and we also know that services are fragmented. As we have been discussing throughout the past 3 days as well, we know the assistive technologies market is fragmented. As CHAI, the responsibility we are taking on is to serve as an ecosystem catalyst. What we mean by that is we're looking to partner with you all, with every sector represented in this room, to change, to reimagine what assistive technology access could look like, and working with you all to design new solutions that actually work for our context. So what is our approach? We have a three-pronged approach in which we're looking to do this. We're looking to partner to, first of all, build and strengthen government capacity for including assistive technology in government systems, and we believe this is the more sustainable pathway to accessibility. Secondly, we are looking to work with you all to shape assistive technology markets. What exactly do we mean? We are looking to increase knowledge and awareness of where products are found, who is providing these products, what is the price of these products, and taking it a step further to bring the price of these products down so that they are more accessible, more affordable, is exactly what we mean. And thirdly, we need long-term sustainable financing. And it is a collaborative effort for us to make sure that the gains we realize in assistive technology access are actually sustained. Of course, we're not doing this work alone. We're working with several other partners, AT Scale, Global Disability Innovation Hub, the Lego Foundation, UNICEF, and many others. We're working in 14 active program countries currently, and we're looking to expand further within the region. Some examples of our regional achievements include 10 countries so far have launched their first ever strategies for scaling up assistive technologies, which is essentially creating an enabling environment for scaling up assistive technologies in the future, a very critical step. It's quite a good fortune that we're meeting here in Kenya about a year after Kenya launched rehabilitative services and assistive technology strategy last year, so we're very happy to be here. Secondly, some of the countries we're supporting are now starting to strengthen digital systems for assistive technology. 5 countries, which we know to be exact. And 6 countries have launched what are called assistive product lists. These are essentially tools that are used to communicate what the government priorities are for procuring assistive technologies. So what am I talking about, and how does this fit into digital inclusion? As CHAI, we see potential area of involvement in 3 areas, which I would like to leave a few examples with you to think about. One example is digital data systems. In Rwanda, for example, the Rwanda government is pioneering a phenomenal data system called the Disability Management Information System. This system is used to do door-to-door screening within communities to identify people who are living with disabilities and linking them to critical services, including healthcare services. This system has actually attracted a lot of attention in several African governments because more than 120,000 people with disabilities have been identified to date. We are looking to replicate this model in several other countries. Another example I can give is from South Africa, where 85% of eyeglass service provision is done through the public sector. As you can imagine, if you use paper-based systems, you can really encounter long wait times, which will not do any good. So in South Africa, there is an optical lab management system, which is used to improve eyeglass dispensing rates, which can be as low as 41% in some provinces. But we're looking to increase that by digitizing eyeglass dispensing and reducing long wait times. A second area of focus for us is digital solutions for assistive technology provision. An example I can give to help you understand what we mean is in South Africa again, we're generating evidence on a smartphone-based combined hearing and vision screening solution, which is used on mobile technology. This is in partnership with a foundation called HearX Foundation. And when we generate evidence that this model works in rural, remote settings as well, we are looking to support HearX Foundation and the South Africa government to scale this solution within South Africa and beyond. Lastly, some examples I will also give are digital assistive technology itself. I would love to draw your attention to an important resource that is going to be launched around June, which is called a market report, an assistive technology market report, which has been developed again with several partners that are sitting in this very room together with CHAI. Within this report, it lists all the information that we could find on different assistive technologies, including digital products, such as augmentative and alternative communication products, screen readers, and smartphones. Again, speaking to where they can be found, the pricing, and later in the year, we will deliver a second report, which will do a more in-depth analysis of pricing, and which will be using such reports to negotiate price reductions, as mentioned earlier. Looking forward, what opportunities do we have? We believe as CHAI, we have an opportunity to learn together, to work together to enhance digital inclusion. We believe, together with partners and governments that we are working with, that we need to move more towards putting the user at the center of our work. And what do we mean by a user? A user is, of course, people living with disabilities, but also extends to providers of services, also extends to families that are in the communities surrounding users of digital assistive technology. And once we understand those needs, we need to build supportive structures, supportive policies. We need to make sure they are more affordable products. We need to make sure that the products that we are delivering are actually fit and appropriate for context, supported by service delivery networks that actually work and are meaningful for the context in which they're delivered. And lastly, increasing levels of awareness for assistive technology. I would like to leave you with a gift, which is a publication that was delivered 4 years ago, but of course needs updating with support from you all in this room. But it highlights some of these areas, these 5 areas that I've mentioned that are critical tools for increasing digital inclusion and assistive technologies more broadly. I thank you for your attention and I look forward to partnering with you.